Awesome. Our topic today is getting the most out of research supervision, and our presenter is Professor Jonathan Carapetis. He is the director of Telethon Kids Institute, and additionally, he's a professor at UWA. He's a pediatrician as well, and his research interests include rheumatic fever, rheumatic heart disease, other group A streptococcal diseases, vaccine preventable disease, indigenous child health, youth health and education, and skin sores and scabies. Professor Carapetis has supervised 32 PhD, master's, honors clinical trainees, and others in research. And he's very passionate about teaching early career researchers. So we're privileged to have him presenting this topic today. He'll join us at the end of the presentation for a Q&A session. So I'll ask that if we have any questions, you can note them down, or you can type them in the chat box and he'll answer this at the end of the session. So I'll just switch over to the presentation. Thanks for joining in.
We are on the land of the Whadjuk people of the Noongar Nation. I'd like to pay respects to elders past, present and future. Today, I'm wanting to make sure we pitch this at a range of levels, because not everyone who gets interested in research supervision wants to do a PhD or wants to supervise a PhD student. Not everyone who gets involved wants to become a researcher for the rest of their career. There's a whole lot of different types of research that people can get involved in, including fairly small projects or more kind of audits. And I want to make sure that all those types of relationships are covered off today, hopefully from the point of view of the person who's the supervisor as well as the person who's being supervised. Because it's such an important relationship. It makes a difference not only to the quality of the research, but the experience itself essentially sets the ground for whether or not the person who's being supervised is going to want to do it again and going to want to really value the research experience. So for me, that's really critical. So what I'm going to do today is take you through what we mean by research supervision. I'm going to spend a bit of time as to why you even bother, either to get involved as a student or to get involved in taking on students as a supervisor. We'll talk a little bit about what the responsibilities of the supervisor and I'm going to call it the trainee, are, and those responsibilities are sometimes very formal, but there are also some fairly informal responsibilities. Regardless of whether or not you're doing a formal higher degree by research or it's just a small project, for example, in a hospital, the responsibilities actually remain the same. We'll get into a bit of the different styles of supervision. This comes down to how you might want to approach that relationship and how you might want to do it better. We'll get through the stages of research supervision, and at the end there'll be some links to some additional resources. Like I said, I want to make sure that anyone who's listening or who's watching who wants to get involved in research or research supervision is kind of getting something out of this. So we'll talk at the different types of relationships. So what is research supervision? So supervision, there's some definitions up there. The critical point is that supervision in research evolves over time. So yes, you are critically watching, you're directing, but there's that concept of charging, guidance, surveillance. When you start off a project, a supervisory relationship, often there's a much more direction that's provided. But over time, as the trainee gets into the research project, as they understand it better, as they feel like they are getting on top of the content area, then that relationship becomes much more mentoring, advising, even collaborating. And some of my best experiences are those initial research supervision relationships that have gone on to be genuine research collaborations in the long term. And some of my greatest collaborators are former PhD students of mine. So why would you want to get involved? So this is trying to think about the perspective of the person who wants to become the student or the trainee, who's thinking of maybe getting involved in research. So classically as a research organisation, so I'm at Telethon Kids Institute, classically we think of it in terms of the research career. And what I've got there is the classic research career that the whole Australian system is built around. That's the research system. So that might start as someone who does an undergraduate degree. They then get involved in postgraduate research. It might be an honours project, it might be a master's or a PhD, and then they say, yes, I want to be a researcher, and so there's a research career that begins as an early career research fellow. They become what we call an independent researcher, setting their own direction, getting their own grants, ends up with people being a professor. That's all well and good, but the vast majority of people who get involved in research are not going to follow that pathway. So there's lots of other reasons for people to get involved in research. You might want to incorporate research into your career that's not necessarily a research career. So you might be a health practitioner, you might be involved with government, making policy, you might just be in business, and you want to make sure that within those practices you can incorporate research. That's a very good reason for you to be wanting to take on research. You might just, rather than incorporate research into your other career, you might just feel like you want to understand research, understand evidence, so that you can then incorporate that aspect into your career. So a health practitioner might just want to know, if I'm going to think about how to treat this individual, I want to make sure I'm on top of the best evidence so I can offer the best treatments. There's nothing like having involvement in research to get your thinking in that systematic, critical, appraisal way. You might just want to get involved because you just want to do your job better. You want to feel like you want to expand your skill sets to do your job better. You might be driven simply because there's a question that nobody's answered and you want to answer it. And then there's the other aspect, which is just because you want to. And all of these are perfectly valid reasons for people to get involved in research. On the other hand, why would you want to take on a trainee or a student? What's the reason to want to do that? I would hope that the reason at the top is the most important one, that you want to actually make a difference. And when I say make a difference, there's two ways that you can make a difference here. One of which is that the actual research is going to be important research that will hopefully lead to some new health interventions, some better outcome for people. But it also might be that you want to do it because you want to make a difference to that person, that trainee's career, to their trajectory. You want to help develop them into a stronger, better researcher. And in so doing, you're inspiring new researchers. And there's nothing I like more. And I've said this a lot, it's the thing I most enjoy about my career. I do a whole lot of different things in my career. The thing that I most value is sitting down and working with earlier career researchers, with PhD students, with people who are just doing small projects, and just talking about how they might develop their research programs, and hopefully getting them interested in research for the future. You might want to do it because you're the one with a question that you want to answer, and the best way to do it might be to get a student to come in and help do a project. Sometimes supervising students, in fact every time I would say, supervising students or trainees opens up new avenues because they bring with them their own connections. They also are often exploring an area that's a relatively new area, and so you and the student together are exploring new collaborations. So it's a way of expanding your own exposure to new collaborations and new disciplines. There's some practical aspects of why you want to take on students or trainees, one of which is you might want to complete a project. And the bit I wrote there, which is with limited resources, that's kind of a nice to have. It shouldn't be your motivation, but the reality is that students and trainees are cheaper than employing research assistants, for example. So it's a way of getting work done without necessarily having to have a lot of resources. And of course, out of that will come publications and grants. And what I would say is, if you're thinking about how to complete a project, have some resources, and you might be interested in maybe getting that done by running it yourself, employing research assistants and doing it that way, or there's an alternative, which is to get a student involved. The real advantage of getting a student involved is that they have intense ownership. That's their project. This means a lot to them. It's not just a job. And so you will often get much more productivity out of a student because this is their career. And yes, there are some advantages about funding sometimes. Some students come with some funding, their scholarships might come with some funding, but that should be irrelevant. I would hope that most people who take on students are doing it for the reasons at the top, because it makes a difference, not just the research, but also to that research, that student. Why do I do it? As I said, it's the most enjoyable part of my job. I liked that idea that I'm helping to produce the researchers of the future. If the next generation of Telethon Kids Institute is stronger, partly because I've helped to supervise some of those students who've gone on to become the researchers of the future, then that's a great outcome. Some of the best research that I've been involved in has actually been done by my students. So it's a mistake to think that a PhD, an honours, a master's student or a trainee doing a project, for example, in a hospital department is inevitably going to produce research that is not as high quality as something I might do myself. That's absolute nonsense, because the projects that I'm most interested in, the most impactful projects, are ones that I would try and get a student to be involved in. And so some of the best research I've been involved in has resulted from those students. I love the opportunity to just talk to students about their lives, about the topics. In a very busy life of someone who does their own research, who does a lot of management work, who might do clinical work, you don't often get a chance to sit down for an hour, talk to someone in detail about their project. And I just love that opportunity. And when you get to a certain age, inevitably there's something about hanging around younger people that you quite like. All right, now let's think about some of the details as to what you would want to take into the relationship between supervisor and supervisee. And what I would say is that anyone who's, particularly as a supervisor, at some point you've been the supervisee, and you will have lessons that you've learned. So my own PhD experience, I had a fabulous PhD experience, but I would say that the way I was supervised is not the way I would want to supervise others. And so I've often thought about that, what would I do differently? And I'm hoping that I would do those things differently. So learn from your own experiences what to do and what not to do. Try and create the perfect supervisor in your mind, and then try and be that person. This is really important, particularly for the small projects. So often if you've got a multi-year relationship through, say, a PhD or a master's, usually the supervisor's got some experience. Hopefully they're working in a fairly research-intensive environment, lots of supports, lots of study design and biostats and epidemiology supports, but also supports for ethics processes, grant funding. When you're working with a trainee, let's say, again, in a clinical department, often that's not the case. It's not necessarily that it's going to be very research intensive. The supervisor might not have actually supervised a lot of research. There might not be a whole lot of other students around for that student or trainee to chat to. And that's why I would say that the whole concept of what support that relationship needs is most important for those relatively small projects, because a bad experience is going to turn someone off research for life. You want it to be the best possible experience they can have. And that means as the supervisor in that sort of setting, you need to understand what your potential limitations might be. How can you bring them in? If you haven't done a lot of research, can you bring another supervisor in who has done a lot of research? If you don't actually have access to a whole lot of those resources, those support structures, is there an organisation around that could help out? In this hospital, in Perth Children's Hospital, for example, we have my institute, Telethon Kids Institute. We've got a whole lot of supports that can be drawn on to help supervise people. But you want to make sure that you're not just going into a relationship of supervising a trainee without thinking about this carefully, because that can really backfire. So this is kind of restating a lot of that point, but when you're the trainee, let's say when you're a clinical trainee and you're trying to think about whether you're going to take on a project, you're looking at the potential supervisors, you want to make sure that there's a connection. So I think you need to do your homework. You need to talk to the supervisor, maybe find out, have they supervised projects before? If they haven't, that's often fine, because they're often enthusiastic, they're keen. But then you want to say, well, how can we make sure that we get the right topic, that we get the right sort of skill sets that we can draw on? The environment to support the project is really important, and I think that the worst experiences I've seen have been people who've just really been floundering about in a department where people really aren't that focused on research and they're not getting that support. The other aspect about the choice of topic is the size of the topic. You've got to think very carefully in a project that's not going to be a multi-year PhD how long have you got? How much time does that person have available? Are they fitting this around the edges of a full-on day job? Are they a full-time clinical trainee and they're having to do this on their nights or on weekends? What's realistically the time they'll have available? What's the speed that they will need to move at? For example, if they've got to get ethics submissions, and that takes time. If they've got to do all the other governance aspects, and that takes time. There's a whole lot of projects that people get into that are bigger than Ben-Hur at the start and were never achievable because people didn't really do that thinking. I would much rather take on someone with a project that's too small than too big. A small project can always be expanded on. A project that's too big, if you get halfway through it and you realise, goodness, I'm never going to finish this, it's really hard to pull back. Do this thinking well in advance. So I just wanted to give you some examples of some great supervisory experiences that I've had. And this goes from at the top, the ones that as a supervisor were the easiest, down to the ones that started getting a bit more difficult, just to give you a bit of a sense. Now these are all kind of PhD experiences, but there are plenty of other ones that I've got around people who've done smaller projects. So the simplest one was when I had a guy walk into my office, a doyen, a demigod of the field I worked in infectious diseases. He was later in his career and he'd never actually done a PhD, and he said, I'm interested in doing a PhD. I saw that you've got this project. Would you be interested? That was so easy because he already had a CV that was 3 times as good as mine. He knew how to do research. He'd just never actually gone through the PhD process. That was one where I kind of just sat back and just let him run with it. Really easy, fabulous experience. Moving down, there were quite a few people who I've supervised who you think that person is going to go places. They've got all the ingredients. They're dynamic. They've got the fire in the belly. They know how to write. They've got a scientifically focused mind. Many of those people are now established stars, and as I said earlier, they're now great collaborators of mine. Again, a fantastic, very positive, and relatively easy experience for a supervisor. Then you get to the people who've just been amazing. So one of my PhD students was a paediatrician who somehow, during her PhD, she managed to have 3 babies and still managed to get her PhD finished. And so whenever I have a PhD student who comes up who's thinking of maybe in the next few years also starting a family, I get her to speak to this person and say, this is how you can do it. She's a superwoman, but it's not necessarily for everyone. People need to understand the joys and the risks of having family, of expanding a family during, for example, a PhD, and you need to go into it with your eyes open. Then we started getting to the really interesting ones. So a young medical student who took on a project and ended up, it was hard work because she was very early career. She didn't really understand research. We worked hard together, but she did some amazing research that turned into to be a publication around a pivotal paper. And it was fascinating to then watch what happened to her. She went back to finish medicine. She's now, I think now actually completed her PhD. She's already an established researcher. And that's a great feeling as a supervisor because that meant that she actually had a really good experience and she wanted to keep doing research. The other one that's also a great experience was at the bottom, and this is when it gets quite hard as a supervisor. You take on people who you think have all the ingredients, but it turns out that they're struggling with some aspects, and particularly academic thinking, academic writing. That's not a natural skill that everybody has. And these are the ones where I've had to work really hard. And you've got to keep people's enthusiasm up because sometimes they just feel like this is going to be too hard. But to be able to work through that with a student who over time manages to master those skills and ends up producing a high quality thesis, great papers, there's this intense pride you have as a supervisor that you've managed to support that person through it. So some great experiences you can have, but there are also lots of not great experiences. And these are the pitfalls that people just need to be aware of and we need to avoid. Every one of these is every one of them can either be prevented or can be better managed. So there's plenty of PhDs that never get finished. And I'll get on to the kind of part-time versus full-time PhD. I would say that true of many of the smaller projects, the projects that are probably too ambitious at the start. If a supervisor and a supervisee or a trainee clash, and often it's a personality clash, sometimes it's a style or other clash, that can be just horrible. And sometimes you end up having to go through mediation, sometimes the relationship just falls apart. But most of the people who've had a bad experience in research, it comes down to that, the clash between the supervisor and the supervisee. That lack of awareness about what it's actually going to take. And I got to tell you, when I went into my PhD, I didn't actually know what that meant. I kind of knew I wanted to do a few years of research. I'd actually never read a PhD thesis, believe it or not, and I managed to make it work. But going into a project, going into a multi-year or even a small project, not knowing exactly what you want to produce at the end and what it's going to take to get there, that's something that is absolutely preventable. And part of that is, do you have the available resources? Going into a project, starting it knowing that there's no way you can finish it because you don't have the funding or you don't have the skill sets that are available, that's a recipe for disaster. The supervisor, as I said, you don't have to know research to be a supervisor. What you have to do is have access to the skills that you don't have. And the supervisor who doesn't know research well and doesn't seek that assistance, also a guaranteed disaster. This next one, it unfortunately happens a lot, and I'm disappointed, and I hope that we are trying to deal with this, but there are bad research practices out there. There are people who are supervisors who are trained in a way of research that I think is an archaic way. They are focused on owning their own data. They don't want to collaborate. They don't want to share, whether it's authorship or whether it's intellectual property. They essentially don't have that essential skill of generosity and collaboration that makes a great researcher. That's what you want to take into your relationship with your trainee. But if you don't have that, your trainee is going to learn from you, and you're breeding someone in your own image. So I think there's a fair bit of self-realization that people need to get to. And as a result, the bad experience with a supervisor can put that supervisee, that trainee, off research forever, and that's the last thing we want. And I also don't like this one, the last one, which is, if you've had a bad experience before, or you just think it's too hard as a supervisor, then you're avoiding taking on new students, new trainees. And that, I think, is unacceptable in an academic world. If I have any researchers upstairs who are studiously not taking on PhD students, not taking on Masters and Honours students, not supervising projects, then I think that's not what it is to be a researcher. We need to be training the next generation. That's part of what we do. All right, this is an important one. This is specific to PhDs, and it's about the full-time versus part-time discussion. So when you enroll in a PhD, you can enroll full-time. 3 years of full-time research gives you a bit of time on the side to do a bit of extra work, some extra paid work, for example. We get it up to a day a week. But basically, you are committing to the next 3 years of essentially full-time focus on your PhD, which I did. I loved it. There's no other time in my life when I've got to spend 3, in my case 4 years, just on one topic, becoming an expert on that topic. You don't get to do that very often, and it's something to be treasured. The full-time PhD absolutely is the best way to do the research. You are most likely to get your research completed. It's a very fulfilling experience. But the reality is, increasingly in this world of people who are embarking on careers earlier, who have various financial and family commitments, it's not easy for someone who might, for example, already have a career and they say, okay, now I want to do a PhD. It's sometimes not easy to just walk away from that for 3 years, focus on a 3-year full-time PhD, which is why the part-time option is available. Very flexible. You can have a full-time job and fit this around the edges, but it is often very stressful. You've got competing priorities. Often those other priorities end up taking priority, and therefore, as I say at the bottom, the world is unfortunately littered with part-time PhDs that never got finished. That doesn't mean it's not a good option, but you just have to be aware of the pitfalls, and as a supervisor you have to be regularly checking in with that student about how they're progressing. Are all those other things in their lives ending up taking preference over their PhD? How are you going to work with them to make sure it's finished? So without a doubt, if you can do a full-time PhD, I still think it's the best thing to do. If you're going to do a part-time PhD as a student and also as a supervisor, make sure you're aware that this is going to be a long road. It'll be a rocky road, but in the end, if you do it well, the result is still fantastic. All right, so let's just go through some of the responsibilities. Some of this is very formalised. What you just need to know is you can't go into a supervising relationship or as a trainee or a student without understanding that there are some obligations here. This is serious. It's not something you can just dabble in and not think about all the other implications. So there's a thing called the Australian Code for the Responsible Conduct of Research. All research organisations sign up to this code. We are obliged to comply with it, and it provides very clear responsibilities of the institutions. So we are committed to provide ongoing training and education to support responsible research conduct. We are committed to ensure that supervisors are appropriately skilled, qualified, and provided with the appropriate resources. So again, the institution has its responsibilities. The researcher, the supervisor, has their own responsibilities also embodied in this code. They are obliged to provide guidance and mentorship. Where necessary, they need to monitor the conduct of the supervisee. They need to make sure that they are not breaching any aspects of the code. They need to make sure that appropriate research conduct and responsible research conduct is understood by the supervisee. There are ethical and legal requirements for any research project, and that's not something you as a supervisor can delegate. And I'm not just talking about PhDs, I'm talking about a research project anywhere. You need to make sure that the student meets all their training requirements. There's some things like ethics committee reporting. You need to make sure that there's both ethical clearance but also reporting to the ethics committee. Where there's a need for training, good clinical practice training, you need to make sure that you and the student have ticked that box. You need to understand if you're going to be taking specimens or collecting data that they have all the appropriate security, privacy and confidentiality around that. You know about the genetically manipulated organism regulations, biological safety. In other words, you can't just go into this without understanding what the requirements are. And that's true also for projects that are much more quality improvement projects. So this is an example from Child and Adolescent Health Services, that there are very clear guidelines around approvals, around training, even for people who want to do an audit in the hospital. Again, there's an approvals process that you have to go through to get that. And the trainees, in return, have their own obligations. They can't just put everything off to the supervisor in the institution and say it's your fault if things aren't going well. They have to demonstrate a professional attitude. They have to be accountable. They have to play an active part. They can't just be passive. So, for example, scheduling meetings with supervisor, getting agendas prepared, that's the trainee's responsibility. And also making sure they get the right training as needed. All right, so let's get into so that's the kind of technical stuff. There's plenty of resources that you can find around that. This is more about the style, and this is probably more important when you're thinking about how you're going to enter in this relationship. So there's kind of 4 types of styles that are listed there. The more sort of functional style, which is really about ticking off boxes. So establishing what the tasks are, setting your milestones and your timelines. That's really it's important, and some people enter into a supervisory relationship very much with that as the priority. The people who are much more into the critical thinking, so a bit like a journal club where you're really encouraging the trainee or the student to delve into the scientific issues and understand them. There's a style that's much more about an apprenticeship, about a mentoring relationship. Well, I guess that's the next one, but around making sure that they are set up for their future career. So one where you might be connecting them to other people, networking them, getting them to focus on publications and grants that might even continue beyond the project. And then there's that more personal mentoring, which is about career advice about what's happening in the rest of their lives. The reality is that a good supervisory relationship has all of that in it. You can't just pick one or the other. You have to do all those things because you need to make sure that you are meeting requirements. You need to make sure that the trainee is getting those skills. You need to make sure that you are not just saying, all I'm responsible for is the project and nothing after it. So you're preparing them for what comes next. And you need to be developing that relationship where you understand what's happening in the rest of their life. So you've got to understand a much more holistic approach to supervising when you get into it. So these are my own tips for for how to get into it. And the first one is most important: check each other out. So don't just identify a name of a potential supervisor as a trainee and say, would you mind doing this? Make sure you check out whether or not they've got the right personality, a good fit with you, have they got the right skill set. And similarly, as a supervisor, I will not take on a trainee just out of the blue without getting to know them and understand them. To do it, but I want to make sure that we're very clear as to why that person's wanting to do it. What's their motivation? What do they expect? Do they understand the responsibilities I just talked about? And then, of course, there's the technical details about how often we're going to meet and what sort of process they can expect during that. And yes, you also need to understand what is happening in their life outside of the research project. So are they planning to get part-time jobs on the side? Is that potentially going to be a risk for the project? And now, increasingly, we don't just have a single relationship. Often there's many people in the mix, and so you need to have that discussion up front. Often there's the need for panels, for having an extra person as a mentor. These are all great ideas. My advice in terms of producing supervisory panels is not to be too inclusive at the start. Usually for a PhD, for example, you'll pick at least a couple of supervisors. Often these days you need to have a larger panel, but you don't necessarily need to identify all of them up front. One of the big mistakes can be to identify a supervisor as a possible supervisor, to invite them as a supervisor, and then realise 6 months later, actually that's probably not the best idea. And you can't uninvite someone as a supervisor. You're much better off just taking your time and thinking, okay, now I need some additional help in biostatistics. Maybe I'll find a biostatistician to be a supervisor. Or I'm realising there's a certain clinical discipline I might need some help in. That's when you can invite people into the mix. And at that point, you need to, you've had that kind of checkout process, you've learned a bit about how each other operates, you've talked a little bit about what your expectation is as the supervisor, what the trainee's expectation is out of this. You then need to kind of make a call. Do you want to proceed or not? Hopefully you'll decide that you want to proceed. And then you really need to get down to the details. And I've put this reference checking thing, something I really encourage, and I don't think people do enough. If I'm going to take on someone, now if it's a small project, I often won't do this bit, but if it's a large project or a PhD, what I will first do, if we've decided, yeah, this all sounds really good, I'll then give them a list of my previous PhD students and say, I want you to call at least 2 or 3 of them and just talk about it. Talk about their experience and make sure that you understand how I operate. And I won't be at all offended if you come back to me and say, you know what, I don't think this is going to work. But I want them to go into it with their eyes open. And so do that. And do that, so as a trainee, ask your supervisor if you can speak to some of the people they've supervised before. And similarly, if I'm taking someone on, I will often ask if they mind if I talk to the current boss of their department in which they work, someone who can give me a bit of an idea as to how serious and how qualified they will be. You then need to decide after that, yep, we're ready to go, and are the students aware of what the commitment is, particularly for higher degree students. So if it's a single project that's only going to last 2 or 3 months, that can be quite straightforward. If it's going to be a multi-year commitment, you need to make sure everyone's fully aware. And similarly, the student, you want to, when you're ready to launch into it, you want to make sure it's the right decision. It can be easier to say no at the start rather than to try and change things midstream. Then you need to align your expectations, and that's, again, it's about communication, it's about clarity. A lot of supervisory relationships, there's this vagueness. The student walks out of a meeting with a supervisor not entirely sure what the next steps are. So at the end of every meeting, it's writing down what are the tasks, what's the timeline, what's the requirements. And also how you're going to communicate with each other. Is the student going to take notes and then send an email summary of the meeting? But that's really important, so that because sometimes you come out thinking, yep, I know exactly what they're going to do. The student thinks, yeah, I know what I'm supposed to do, but in fact those two things are not aligned. So make sure you're aligned. And then it's about how often you'll meet. So often in a project, when we start the relationship, we'll meet frequently at the start. We might meet once every week and to get things up and running. But if it's a big project, then those meetings might stretch out during the middle when things are working okay, data's being collected, literature's being reviewed, and we might meet less often. But then as we get closer to submission date of a thesis or a paper, then we might start meeting more regularly. So you can be flexible about that, but be clear. And as a supervisor, the thing that really annoys me is when people don't take it seriously and don't understand the implications of not committing to those timelines. So cancelling meetings, now a busy person often has to cancel a meeting, but if you do it, you reschedule. You make sure that you're not leaving your student hanging. You enter this relationship seriously. This person's relying on you as a supervisor, and so you need to make sure you commit to it. You commit to the meetings, you commit to meeting their requirements, and you commit to turning things around. That's the other thing that drives me crazy is students who send a draft of a paper or a manuscript, something they've written, some results analysis, and the supervisor doesn't turn it around quickly. And the student often just is sitting there, they're twiddling their thumbs, they can't progress until they've got the feedback. Some people it takes months. I think there are lots of things in our lives that we need to prioritise. If you take on a student, you've got to prioritise making sure that you give them the feedback quickly. Remote supervision. This used to be a no-no in the past. In other words, you're in Perth, your student's in Darwin, that's really hard to maintain. I think these days it's much easier, and obviously in the middle of a pandemic we've all learned how to work online, so I think it's actually something that's perfectly acceptable. You just have to make sure you understand how to do it. And the challenges are around, you can't have that face-to-face interaction as much as you'd like to. You are dependent on their local physical environment and their working style, but I do think that remote supervision's fine. Ideally, you'd have someone on site who's kind of at least being a mentor, if not a co-supervisor, and there would be at some point some face-to-face meetings, ideally in the first 6 months. And in fact, some formal enrolments may actually require you to be physically co-located. I think universities are increasingly flexible about that, though. Okay, so the early stage of supervision of a project is, whether it's a project or a full degree, like I say, you often have a supervision team or panel. Often this is about setting the scope, setting the baseline. There will inevitably be a need to review the literature, and this is required no matter how big or small the project. Even the smallest project, you want to make sure you understand what we know already, what's been done before, just so you know, are you repeating something that's already been done before? Are you genuinely carving out new territory? And what are the unanswered questions? You need to undertake the planning process, getting all your approvals, your ethics approval, your training as needed. Make sure you've got the resources. So it's a kind of a setting the groundwork for what will be the next phase. It can be quite frustrating for a student who wants to get into it, and they're feeling like they're often kind of floundering a bit with these things they've never done before. What I always like to do is to say, let's get some early writing milestones underway. Let's find a piece that you can write. Often it's a literature review. Ideally, every literature review should be something you aim for publication. But let's get some feedback. Write me a paragraph on this, a summary of what you're finding in the literature. It's a great way of understanding how well the person writes, and I'll get onto that in a second. Because this is the biggest challenge in my experience. It's about writing. Just go back to that. So, like I said before, there are some people for whom scientific writing is just a real challenge. And that's not their fault, it's just the way some people are built. And I think of all the different challenges that a student can face, whether it's around the ethics issues, whether it's around the challenge of data analysis or data collection, the one that's the most confronting is when someone sends you a piece of writing and you think, wow, this is not up to scratch. And it's about how you manage that, how you feedback you need to give some significant guidance, but you can't just rewrite things for people because you are there to help build their skills. So it's about giving them some feedback, saying, okay, I'm going to give you some feedback. I want you to go away and try and write that one again and come back to me. And like I say, it's a thing that can be the most challenging, but it can also be the most rewarding if you get it right. In the middle stages is when it starts getting fun. You're starting to recruit participants if you're doing a clinical project. You're collecting data if you're doing maybe some experiments in the laboratory, and you're starting to get some early analysis. And that's also when you're developing your broader skills. So it's very important that the students out there learning how to present, that they are, and this is a really important skill, their oral presentation skill. They're doing critical reviews. They're getting lots of feedback. So this is really where the supervisor has to make sure they're giving feedback, they're tracking progress. It should be an exciting time for the student. It can be overwhelming and it can drag on forever. And this is a time when often you'll have that discussion around how does the student want to operate? Do they want to operate according to deadlines? That some people don't. Some people say, no, these are the things I'm working on, I'll get them to you when I'm ready. Inevitably, at some point, you say, okay, it's time for us to set some deadlines. I want a draft of this manuscript by June the 30th. I want by July the 30th, I want to have X and Y and Z. But some people want deadlines all the way along, some people don't, but you have to be clear with each other. And then you get to the kind of the fun bit, which is the analysis and the preparation of your outputs. And this is the bit where often the students have really struggled to start getting excited because they're seeing something coming out of the research they're doing, they're analysing the data, they're starting to write it up, and that's really important. Even if you're doing a PhD, yes, your PhD will depend on the thesis that you submit. Increasingly, luckily, where there are PhDs by publication, my comment to my students is always, the thesis is the thing that's going to get you a PhD, but it's only going to ever be read by usually 2, 3, maybe a few other people, maybe a mum, but not too many in the science community are actually going to read your PhD thesis. What they're going to read is your publications. So you always should be prioritising those publications, and that's absolutely critical. Sometimes you need to be preparing to, not just for examination or peer review, but also an oral presentation. This is the period that can be quite emotional, it's quite stressful. It's the challenge for the student to try and bring it all together. One of the aspects that I love doing is really making sure I put aside time for the students at this stage to get them to think about what the implications of their findings are. It's very easy to say, I found X, and think about writing that up. It's what it means. What could it mean to the problem you're trying to solve? What could it mean in terms of the next steps? That's the really intellectual exercise. That's the fun bit of research. All right. And then the other aspect that we used to neglect is what other training might someone want to require. You kind of think this project, if it's a multi-year degree, they'll get lots of exposure to research methodology along the way. And back when I did my PhD, we didn't really think about what other things might you want to do. Now there's lots of formal training, formal workshops that can be used to augment the project that the supervisor or the supervisee is undertaking. So it might be wanting to do some extra training around biostatistics or around modelling or around health economics, but making sure that you're having that discussion, that the person is able to fit in that formal training, I think is really useful. And it might not just be around research, it might be about preparing them for life afterwards, which might have nothing to do with research. So for example, there might be a secondment in a government department or a company where they'll get exposure, a bit like a work experience. That can and should be incorporated into the supervising. And also really understanding that things do change, especially if it's a multi-year commitment. And so what has happened this year might not be the same as what's going to happen next year. And sometimes it's around family, sometimes it's around employment, sometimes it's around health issues, you name it. So you need to make sure that you're anticipating those things. And if things go wrong, Well, there are things you can do. There's a whole lot of reasons why things go wrong. Hopefully you're anticipating them. Some of these I've talked about, whether the original project was feasible, but maybe it is no longer feasible. Maybe circumstances have changed and you can't actually collect those data or whatever it is. That the student or the supervisor might have moved, or they might have had something else happen in their lives. The critical thing, as always, is communication, anticipation, and discussion. It's not letting these things sit. And so that's why there's that mentoring aspect of the relationship. It's checking in from time to time and then figure out what are the ways around that. Are there some solutions you can come up with? Are you potentially changing the project itself, changing what the outcomes and methodology might be? Is there a need to bring in some additional supervision or maybe even alternative supervision if it's just not working out between you? Does the timeline need to spread out? And of course, if things are really going bad in the relationship, do you actually need to get a third party in there to help mediate and facilitate? That's obviously a late stage. We want to try and avoid it, but really anticipating if things do go wrong. And there are supports. So there are supports within research organisations, there are supports within service providers like hospitals and obviously at universities, so that they will be able to work with the supervisor and the supervisee if problems are occurring. So in summary, I think it's the most important part of research. If someone comes to me and says, what are the major determinants of success in, for example, a PhD, I will say it's the supervisor and supervisee relationship, number one. Number two is the environment in which the research is being done. Is it supportive? Does it have all those facilities? Number three is the topic. So everyone thinks that the most important thing must be choose a killer topic. It's actually not the most important ingredient of success. Yes, you want something that motivates you, but you can do fantastic research on a pretty boring topic if you've got the first bits right, the supervisory relationship and a great environment. You cannot do good research on a killer topic if those two other ingredients aren't there. So it's a really important part of research. If it's done well, not only will you produce great research outcomes, you'll also have a happy supervisee, a happy supervisor, and you'll have a supervisee who wants to do more research, but you need to plan. You don't enter into it lightly. You need to prepare and avoid those ad hoc arrangements. So there are lots of additional workshops and resources, and these will be available in your handouts and online. There's no shortage of people, and that includes the CAHS Postgraduate Medical Education Office.
Very interesting. So maybe I'll just start off the questions. I'm not seeing any in the chat box yet, but I'll probably start off. We talk about who came first, the egg or the chicken. Now, listening to you, it almost seems like the supervisor should come first before the research topic. What's your thought on that? Who should come first? Do you think, like for early career researchers, should you think of the topic first, then look for a supervisor, or do you look for a supervisor first and then look for a topic?
So I think it's kind of different depending on the stage of the career. So a lot of my talk was focused on people who were really beginning that part of their research career. So they might be considering embarking on a higher degree like a PhD or an MD, or even just doing a smaller project. So they may not have had, I'm assuming they haven't had a lot of experience in research, and they are just wanting to kind of figure out how to do it. Now, sometimes you've got a driving question that you might want to take on. So sometimes if you're a clinician, you might have seen a patient with a particular condition and you've got questions that drive you. Sometimes you don't have that, but you are just wanting to get experience in research. I think either way, the first thing to do is to really start finding people who you can talk to about it and who can expand your initial discussions, and they may end up being your supervisors. So I think very quickly, whether you've got a question or not, you need to hook up with people you can talk to about it, get sensible advice, either to direct you to someone who might be a good supervisor, or they might be the supervisor themselves. So I don't think there's an easy answer to that. Once you're talking about what we call classically early career researchers, who might be someone who's already done their PhD, who's embarking on a postdoctoral period, That's a little bit different. Yes, you need to often, by that stage, it's pretty clear who your postdoctoral supervisor will be. But the challenge at that time of your career is to really start developing your own ideas and to develop your own projects. And that's when the supervisory relationship over a period turns from being quite directive and hands-on to being more nudging and suggesting and becoming a bit more mentoring. So it does vary. There's no simple answer to your question, but the most critical thing is, regardless of whether you got a question or not, find someone who you can talk to, who can explore that topic and direct you accordingly.
Fair enough. Any other questions for Prof? Yep.
Hi. Thanks, Jonathan, for that presentation. It was very interesting and helpful. So I'm currently employed by the Department of Health, and I'm working as an epidemiologist on the health and wellbeing surveillance system. And I've got some really good ideas, but it doesn't really appeal to me to become a full-time student as such. And I've spoken to a few people in the Department of Health about taking on high degree by research as just part of the work that I do. But then it's finding support within the department from, higher level directors and things like that. And I just wondered if you had any advice or previous students who had that kind of scenario.
Yeah, look, I think it's a very common situation, and it's fantastic that you've got that interest. And we find that when at Telethon Kids, for example, when we're navigating relationships with the department, one of the things we talk about the benefits of a research organisation linking with the department is that there are staff who are actually interested in exploring research, whether or not they might want to do a PhD. They might have some questions, and how can we make the most of that? So there's probably two ways I would suggest. So one of which is to come and talk to, whether it's our institute or UWA, or find some like-minded epidemiologists who might be in the academic sphere to talk about whether or not they're interested in, if you like, partnering with you. And it doesn't mean signing up for a master's or a PhD. It can mean just, can we work together on a project? But inevitably, you're going to need to get support from your bosses to do this work. You got either to get access to the data, to get time to do the work, or maybe you're going to need to be looking for some resources. And that's when it's kind of, you'll have a much better idea than I do about how to navigate that. There are some parts of the department I know that are very encouraging of this, and obviously if I was your boss, I'd say it'd be great for you to be able to do a bit of this on the side. But others where they might be focused on your core deliverables, and for that I don't have an easy answer. We are obviously embarking on a much bigger education process about the value of research in health services and in health policy environments, but it's not straightforward. So, and then the only other thing I can do is suggest that if you're struggling, come and talk to, I can direct you to one or two people here at the Institute who could just give you maybe some advice.
I have previously spoken to Barbara at UWA, and she suggested that I go straight to David Preen and talk to him about it. And I've also met with a couple of people at TKI about potential collaboration. So I have sort of laid the sort of groundwork. I just got to sort of take the next step.
Yeah, well, good on you. And you're talking to the right people, it sounds like.
And in terms of the context of the department, like, I think one thing that's really in my advantage is the need for public health plans by local governments. So that might be how I could frame it.
Great. All right. Well, it sounds like you're doing really well. Happy to, if you've got any further questions, just fire me some emails and we can have a chat.
Okay. Thank you.
Thanks.
All right. Thanks, Candice. Michael, you have your hand up.
Yeah. Hi, Professor Carapetis, and thanks for organising this meeting and putting it on. I'm coming in from, I have a medical degree, and I'm looking at I haven't been in practice for a while. I've been at home and doing other things, but I'm just trying to get an idea of what in terms of funding for research and not just topics. And as you were saying, finding the right supervisors and things like that's important. It's coming in from sort of and I've done some biostatistics postgrad units, but they're sort of out of date. So looking to perhaps get into research and perhaps do a PhD at some stage is where would be a good place to start? If that's not
Yeah,
such a
look,
question.
it's so I guess there's a range of different answers to that. I think
Yeah.
what you need to do is to just understand a little bit about the sort of area of research you might be interested in. Are you talking about primary care, clinical research? Are you thinking about more epidemiology and public health?
Yeah.
So it's kind of understanding that area, and then probably the most important thing to do is identify someone you can talk to. So, for example, here at Telethon Kids, we have a research development team, and we also have a kind of a student supervisor who can often direct some of that traffic.
I can appreciate that you've got enormous resources behind, institutional and otherwise. If you've got that behind you as well, and as well as apart from the topic, etc., that's an enormous resource to have behind you as well.
As to the universities, and that's the thing. I guess one of my slides was very much about that environment. What can be a killer to your interest in research is if you are to embark on it on your own in with a supervisor who's not that engaged. You're still working in your primary care practice or working out of home. You're not in a research intensive environment. You haven't got the support structures. That's where there's a real risk that you will have a bad experience and you'll be turned off research. So it's really important to do that background work, identify someone who's keen to work with you, who potentially can help you carve out a topic. All the questions you've got about how do you get the funding. I mean, I don't know whether there might be a topic on that just for this research school seminar series, but that's a big one. So you've really got to kind of navigate that. I wouldn't jump into anything until you've really got one or two people you can talk to and understood what's the institution you might need to be hooked into.
Hearing that's a good motivation to find not just the right person, but the right group of people, I guess, to a certain. And it's maybe a bit sort of lateral, but it's my son is also doing some study at UWA at the moment. He's doing public health units and what have you. He's not quite sure where he wants to go, just by chance. And so when he decides what he wants to do, and I mean, because they do all kinds of broadening units and things as well, so it sort of adds into the mix of which direction they're going. Not quite sure where they're going to go these days, and I guess people are changing their track quite often as well. So
and obviously being at UWA studying public health, that's for a lecturer at UWA, that's the ideal, is that someone comes up to them and says, I'm interested in maybe doing some research, and then that's often where they get their best students. So you'd hope that he would then be hooked into people who want to sit down and talk about what that might look like. It might start off with a small project, and then that might go to a master's and a PhD, obviously, or it might not.
I think he's on the sort of the master's track kind of thing. There's one where they have them ostensibly committed to a master's from early undergraduate.
That's great.
So, thanks for that.
No worries.
Thank you, Michael, for your comments. Emma, you have your hand up. Maybe you could turn on your mic.
Thanks very much, Jane, and thanks, Jonathan, for a great presentation last year. That was really informative. My question is about supervision cultures between different large institutions and whether you've noticed strengths that institutions can offer. The reason I ask and the context of my question is I have supervisors across one at UWA and one at a medical research institute. There was no kind of pre-existing relationship necessarily between the supervisors. I was the commonality. So I guess they're quite different. The motivations are quite different, and the work of each of my supervisors is very different. So, have you noticed trends between institutions and things that work best and strengths that I can play into from both?
Yeah, I mean, I guess what I would say, Emma, is that usually it's more around the individual rather than the institution. But institutions are taking much more responsibility for this. So as supervisors, we are now required to go through regular supervisor training. We are the graduate research schools at the universities now are much more aware that there are supervisors who probably don't do it as well as others. I don't know. I think every institution has those. I know my institution has that as well. So, and we work across a range of universities. So I think I would hope that over time, the approach, which is to get much better training for the graduate research schools to be much more aware, and I think also for the students to be aware of their rights and for problems to be picked up early. I'm hoping that overall the trend is for better supervision, and I think the larger supervisory panels can help as well. And your experience, I love that for myself, or when I've got a student who then brings on a supervisor from another institution I've never met before, that's actually led to me having some fantastic ongoing collaborations. So that can be a really positive experience. What you're describing is some very different styles. Now that's not necessarily a bad thing. It's only a bad thing if their styles are complementary and if they're not supportive of you. So I would say that it's large. I think all institutions are very aware of this. I think the institutions that are much more research intensive, there are some universities, as you know, that are very research intensive. They tend to be much more focused on ensuring that there's higher quality supervision, and also that the graduate research school is therefore more actively engaged with the students. Some of the universities that don't do it very often may not be quite as adept at that, but I certainly can't identify particular institutions that are better than others. It's usually down to the individual supervisors. That's what I would suggest.
And I also have a follow-up question. Jane, do I have time to ask another one?
Yeah, we can take a quick one.
Thank you very much. I'm also in that more tricky scenario of part-time PhD balancing teaching obligations, and the pace at which I want to acquire knowledge and start progressing through this early period. I am constantly wishing I had more time to dedicate to it. In this initial thing where you're just trying to take all of it on, the subject matter, the writing, navigating the supervision, etc. Have you had an experience with that, and what advice you've given someone on what to prioritise early in the piece? Is it any different to a full-time PhD in the prioritisation that you need to have?
Well, absolutely, because you've got a day job, and so that's the big issue, is how and part of it's around how much you love your day job, and therefore that's the reason you've still got a day job. Often it's you've got to keep food on the table, you've got a family to support, all those sorts of things. And so then it comes down to how do you work. This is where the supervisor should really come in, about how you balance all these different things. One solution that people do look for is essentially, is there the option of reducing your fraction within your day job, either by bringing in dollars to help, if you like, buy out your time, by convincing your boss that actually you getting your higher degree earlier is going to be a good thing, but not only for you, but for them. And sometimes there are alternative ways of actually building some of your research into your day job. I guess if it's teaching, that's a different story. But we, for example, will often employ PhD students, and even full-time PhD students are still allowed to do a day a week of other work, and that other work can actually be related in various ways to their PhD, at least working in the same team, even if on a different project. So there are ways of doing it. You just need to have a supportive both boss and supervisor, and you have to sometimes be a bit creative in terms of having to bring a few extra dollars in. So sometimes your boss will say, well, yeah, I can free you up for another day a week if we can find some dollars so I can backfill you. Those are the sort of creative solutions that people usually try to come up with. If you are really struggling with, you want to do more of the research, but you can't find the time, then it inevitably comes down to, can you actually focus on the research more? What does that mean in terms of what I would encourage you not to try to do is to fit more in to an already packed schedule. You've got to something's got to give. Usually you've got to somehow find free time.
Okay.
Which is why I actually said this is the risk of a part-time PhD. I'm not wanting to turn you off that, because it's absolutely the right thing for many people to do. But what your story is a very common one of, how do I balance everything else I'm doing in my day, in my life, with a PhD? It's not straightforward.
Yeah, I can see that Michael has his hand up. Did you have another question?
I was just thinking, because I've come across a lot of sort of, for example, you can do master's programs or what have you online, say in the US, different institutions. Would you encourage people to perhaps follow where their interests take them, and then perhaps bring the research back here, sort of thing, and work with at home more, I guess, and perhaps as a maybe with a view to sort of summarising, but the overall need for research in WA kind of thing. It's sort of hard to get a global appreciation of what the need is here. I guess for most people.
Yeah, I mean, on the latter one, we have a very thriving research community here. It's growing. I do believe it's a really good time to get involved in health and medical research, certainly, because we've got resources, we've got a government that's focused, we've got universities and institutions working very well together. I haven't had a lot of experience with online master's courses, for example. I suspect most of them are going to be coursework rather than research. I certainly, look, I'm speaking without knowing this topic very well, but I think one of the great joys of, especially early in your research career, one of the great joys you get is working closely with a supervisor, with an individual, or as part of a team. And I can't imagine how that could work well if they're all based somewhere else. So it could work if you can physically embed yourself somewhere
sort of
here.
Encouraging people to have a close network or around in their local. Act locally, think globally, sort of thing.
Yeah, that sounds good.
Yeah, I like your shirt, by the way.
Telethon Kids, we try and come up with a new one of these every year or two.
Yeah. Where can I get one?
Come and work for Telethon Kids.
Yeah.
For free.
Thank you for such an engaging session. And Professor Carapetis, your presence is amazing, and it was nice having you as our presenter. Karen has linked some of the places that we can get support in the chat box, so feel free to tab onto one of them. And we'll have a few seminars coming up. For those who are not very well versed with systematic reviews, the next one will be that on the 10th of June. And on the 17th, we will have an introduction to biostatistics, the big elephant in the room all the time. And then something about sample size calculations. Yeah, so we hope to engage in with you then. In addition, there'll be a link that comes to your email. I think it may already have come in to give feedback about this seminar. So please fill it in. We'd like to improve, and we like to also offer Professor Carapetis some of the accolades that you'll give to him. So thank you so much for your time.
Thank you very much. Thank you very much.
All right, thanks for your time.
Bye-bye.